Hello, I'm Dr. Prasanth Pillai. I'm here to do a video on the tips for NRIs who are looking forward to come to India for dental treatment. So recently I had a patient who's an NRI based in Abu Dhabi who wanted me to make a video on this particular topic. So that is how we are doing this today. So what are the important things which NRIs, that is non-resident Indians, need to keep in mind when they are planning to come to India for dental treatment? So the most important thing is, why are they coming to India? Because it is they feel that they are able to get a very good quality treatment at moderate prices. And the treatment is being done by skilled dental professionals, which is something very, very important. So that is the reason why they are planning to come to India. Now, what are the things they need to have in mind before they plan to come to India for the treatment? That is what I am going to speak to you about. So, first of all, in our center, there is a protocol we follow. I'll just narrate that particular schedule or protocol. Whatever we follow. So the first thing is, we request them to forward their digital OPG X-ray, which is a panoramic X-ray of the jaws, which gives you a very clear picture of the existing teeth, the supporting bone, the jaw joints. It will give us an idea about submerged teeth, impacted teeth, whether there are dental issues which the patient has. Sometimes they have cysts, they have infections which can be visible in the X-ray. You can see bone loss, a lot of things can be seen in the X-ray. So the digital OPG X-ray, we also request them to forward us photographs of their teeth, highlighting the problems, whatever they are facing. We also request them to provide us a brief medical history of theirs, so that we have an idea about their suitability for dental procedures, especially conditions like diabetes, like hypertension, whether they are on some kind of medication for some condition, if they are on anticoagulants. All these are important. And sometimes we request them to forward us their latest blood reports. And after all these are received by us, we provide them with a provisional treatment plan. At times we meet them online for a discussion, and then we finalize the plan and we provide them the plan. And then they decide to come to India for the procedures. They come to India, and the first thing we do is we repeat the X-ray, whatever they've done. We are not going to accept the X-ray which they forwarded. We have the in-house digital OPG and 3D CBCT facility. So we do the entire thing here again. We re-evaluate the patient clinically. We have facility of examining the patient in the X-ray room, so that we are able to see the X-rays and the 3D scans while we are examining the patient. And then we finalize the treatment plan, whatever we've prepared. And we have a discussion with the patient. We provide them with the treatment proposal, which will comprise of the costs as well. And then we proceed with the treatment, of course, after obtaining a consent. They've got to sign a consent form. Now, there are times when we have seen variations in their blood picture, but the blood report, the blood investigation report. In that situation, sometimes we may recommend that they consult one of the physicians available at the local hospital with which we are tied up with. So we may ask them to get a medical clearance before we take them up for procedures, and then we go ahead and start the procedures. And generally, we request patients to be available for a period from anywhere between a week to 3 weeks, depending on the type of treatment they need to undergo. And towards the end of the procedures, we repeat the X-ray. We also repeat, of course, we repeat X-rays and 3D CBCTs during the procedure at times, in order to ensure that we are doing it the right way. And then finally, we do a post-treatment X-ray so that we are able to document the case in a proper way. Now, with regard to treatment procedures which are being done, we perform routine dental procedures like fillings, cleaning, and a lot of other things. We always start with a dental cleaning, which is very important because it's not just cleaning, it is also a diagnostic procedure which will give us a clear picture on the present situation of that particular patient even before we start the procedures, and that will enable us to give them a proper treatment plan. And then we execute all the procedures, which may comprise of fillings, crowns, implants, dental implants, minor surgeries or major surgeries. It all depends on what kind of procedure is being planned. And at the end of the procedure, there are cases where we need to do full mouth rehabilitation, full mouth reconstruction. So all kinds of patients come to us. And then towards the end of the procedures, we do a final OPG X-ray. We also do a final CBCT scan. And all these are uploaded into the patient's folders, and these are shared with the patient so that they are able to produce these reports to their dentist when they go to their respective countries, which is very important because they need to know what kind of procedure has been done here. And then we are in constant touch with our patients, and they keep updating us about their dental visits in their respective countries so that we are able to update these data into their files which we have here. And during their next visit to India, they visit us and we go in for their maintenance procedures. We do their review x-rays and review scaling, etc., etc. This is how we proceed. So I hope I've given you an overview about how we manage non-resident Indian patients. If there are questions, please feel free to ask us. You can definitely ask us and we are there to answer. And I'm certain you will benefit by coming to India for dental procedures because we have all the advanced treatment techniques and the equipment and the trained personnel here. So there's absolutely no problem. In our center, we have a fantastic team of doctors to do the procedures, and we follow a meticulous treatment protocol which will be discussed prior to commencement of procedures. So thank you very much for watching the video. Please share this with your friends and do like the video, and goodbye for now until I come with another video later. Thank you.